Did you know that prenatal stress and birth trauma are among the top reasons that babies struggle in their early years? From colic and constipation to sleep issues, sensory challenges, ADHD, and anxiety, that list of concerns can feel overwhelming. And we've seen it time and time again in our office. Parents filling out intake forms, sharing stories of these stressful pregnancies, traumatic births, or even heart-wrenching losses during pregnancy. These experiences have a lasting impact on both mom and baby. So, how can we help ease this stress for both expecting mothers and their babies? While we cannot control life's events, we can absolutely support the nervous system to process and adapt to these challenges more effectively. By doing so, we can help mom and baby become more resilient, potentially avoiding some of those common struggles that we see in newborns and in young children. So if you're expecting or planning to have children in the future, it's important to know that you can influence your child's nervous system even before they're born. Here at Foundations, we specialize in helping families through the journey of pregnancy and early childhood, focusing on cases that involve birth trauma and its lasting effects. We've worked with countless babies struggling with colic, with eczema, and sleep challenges. We've seen toddlers and older children who began with these early issues that developed into more significant challenges like SPD, ADHD, OCD, ODD, and autism. And in most cases, the common thread is this history of fertility struggles, a stressful pregnancy, or a traumatic birth. These are circumstances that are all too common in today's medicalized approach to prenatal care. The statistics actually paint a troubling picture. America spends nearly $100 billion annually on births. Yet 1 in 3 American women have a C-section, which is far above the WHO's recommended 10 to 15%. 31% of women are induced during pregnancy. 1 out of 7 American women experience postpartum mood or anxiety disorders. The fertility market is projected to grow from nearly $8 billion in 2022 to $17 billion by 2028. So while emergency medical interventions absolutely have their place, our country ranks dead last for maternal and infant outcomes among all of the developed nations. Too often, low-risk pregnancies turn into over-medicalized events, which leads to this cascade of issues that we call the perfect storm. So, how can you best prepare your mind and your body for a healthy pregnancy and birth? Well, here are 4 tips. Tip number 1, empower yourself with knowledge. Have you ever heard the saying that birth is 80% mental and 20% physical? It is definitely true. Being educated about the birthing process empowers you to make informed decisions, to understand what's going on in your body, and to feel more confident as you approach labor and delivery. Tip number 2, start preparing even before conception. So whether you're planning for a future pregnancy or you're currently facing fertility challenges, start preparing your body at least 3 to 6 months before you're trying to conceive. Both mom and dad play a crucial role in creating a healthy baby, so focus on becoming the healthiest versions of yourselves, not just mom. Tip number 3, find your circle. Surround yourself with a supportive team that shares your vision for pregnancy and for birth. Whether it's friends, family, or healthcare providers, ensure that they are empowering you and respecting your choices. And then tip number 4, focus on nervous system health. This is the most important tip of all. Your nervous system controls every cell, every organ and tissue in both mom's and baby's bodies. By ensuring that your nervous system is adaptable and resilient, you can better handle the stresses of pregnancy and birth, which reduces the likelihood of complications and supporting your baby's development. Hormones will often get blamed for everything during pregnancy, but think about what system controls those hormones. It's the nervous system, and when it's dysregulated, you might experience symptoms like cramps, fertility struggles, pregnancy pains, high blood pressure, swelling, and more. By focusing on nervous system health, you can address the root cause of these issues rather than just managing symptoms. Here at Foundations, we use advanced technology like heart rate variability and other neurological insight scans to assess how well your nervous system is able to adapt to stress. These non-invasive tests provide a detailed look at how your brain communicates with your body and how well you're processing stressors. This information is invaluable in creating a customized care plan for both you and for your baby. So the central nervous system is the most important reproductive organ that you have. It controls all other organs and the hormones. Ensuring that it is functioning at its best is crucial for a healthy preconception, pregnancy, birth, and even postpartum experience. So if you're ready to see how your nervous system is functioning and prepare for the best possible pregnancy and birth, DM us to schedule your insight scans. Let's work together to create this care plan that supports both you and your baby giving you the best chance at a healthy, happy start to life. And if you're not local to us, check out the PX Docs directory to find a trusted provider near your area. We're here to help.